Today's topic is acyclovir. Acyclovir is an antiviral agent. It is a synthetic acyclic analog of guanosine with activity against various herpes viruses. Mechanism of action of acyclovir is acyclovir monophosphate is phosphorylated to the triphosphate, where it becomes incorporated into viral DNA and inhibits viral replication. In short, we can say that it inhibits viral DNA polymerase synthesis. This agent is active against herpes viruses, particularly Herpes Simplex Virus 1, Herpes Simplex Virus 2, Varicella-Zoster Virus, and chickenpox. Let's have a look on therapeutic uses of acyclovir. Acyclovir is used to treat initial and recurrent Herpes Simplex Virus 1 and Herpes Simplex Virus 2 infections, and for acute treatment of herpes zosters and chickenpox. It is also used orally for long-term suppression of genital herpes simplex virus infections. This agent is available in topical, oral, and IV forms. Topical acyclovir is applied directly on herpes lesion and recurrent herpes labialis, that is cold sores. It is not recommended for use on genital herpes lesion due to poor efficacy. Acyclovir may be administered intravenously in the treatment of initial and recurrent mucocutaneous HSV infection and VZV infection, that is Varicella-Zoster Virus infection, in immunocompromised patients, as well as in the treatment of HSV infections that are disseminated or affect the central nervous system. Now, as far as precautions and monitoring effects are concerned, oral acyclovir may induce nausea, vomiting, diarrhea, and headache. IV administration may cause dose-dependent renal impairment, crystalline nephropathy, neurological effects, for example, lethargy, confusion, tremors, agitation, seizures, coma, obtundation. Moreover, hypotension, rash, itching, and phlebitis at the injection site. Local discomfort and pruritus may result from topical administration. Acyclovir is removed by hemodialysis. Doses should be adjusted in renal impairment and hemodialysis. Now there are some significant drug-drug interactions. Probenecid reduces the renal clearance of acyclovir, resulting in increased acyclovir half-life and serum concentration. Acyclovir may decrease plasma concentration of phenytoin and valproic acid. Thank you. Keep learning with MediWorld.